Hello all, we're glad to have you with us today. We're going to wait just one more minute for others to hop on the call. But while you are waiting, if you could take a moment and answer the welcome poll that's on the screen right now. And also if you have any lingering questions from the last roundtable, please put them in the chat. Okay, and since we're at 2:01, in the interest of being respectful, we are going to kick off today's roundtable. And so I will hand it to my colleague, Leah Kaufman, to start us off.
Oh, there we go. Hello, everyone. Carolyn, can you hear me okay? All right, great. That mute button's so tricky. Well, thank you all for joining us. So before we get started, we just wanted to mention, if you hadn't watched the roundtable last month, we do have a recording available. So please go ahead and feel free to watch that after this so you can catch up. We are going to cover some of the same content today, but there's some good topics covered if you want to watch that as well. Next slide. So introductions, there's a lot of us on the call today. Carolyn, who you've already met, is our VP of State Engagement. Carolyn supervises Atlas, our Atlas work across the country. Just a reminder, if you're not muted, please go ahead and mute your lines. So Carolyn supervises our work across the country, but she also works directly with North Carolina and New Jersey. You can see Shannon Biella listed here. She hasn't joined us today, but you are going to hear her voice. Shannon was kind enough to record a walkthrough of our treatment facility survey. And so we'll be making that available to you to watch on your own, but we'll play a clip of that today so you can get an idea of what it entails. And Shannon leads our data work. I am Director of State Engagement for Atlas, working with New York, Florida, Oklahoma, and Louisiana. And Angad Bhattar is Director of State Engagement, working with Pennsylvania, Massachusetts, Delaware, and West Virginia. And we will remind you of which states each of us cover again at the end of this presentation. So getting us kicked off here, our agenda will start with the Atlas Facility Survey. So as you all probably know, next week our Atlas survey collection period opens. So we'll be we'll show you the walkthrough of that facility survey, as well as covering some key tips on completing it, talking about the benefits of participation, and finally wrapping up with a Q&A session, so you can ask any questions that you might have. The treatment facility survey, for those just kind of joining this who aren't familiar with it yet, it is the primary source of data that we use to populate treatmentatlas.org. It is going to collect information on the clinical processes that you have in place. So really think of this as submitting information on the menu of services and things that you offer at your facility. It is completed at the physical address level. So if you have multiple levels of care co-located, you'll be doing one survey for that physical address. We have a process that we'll talk about later in this presentation. If you have 2 or more facilities, there is a streamlined process for completing information submission for those facilities. The survey also looks at barriers to delivering high quality care. So our goal is not only to empower the public with information that they can use to navigate to care, but also to empower providers with information on how their colleagues throughout the state are performing, but also we collect information on barriers that you may encounter, such as workforce challenges. I know that's been something we've heard a lot about throughout the pandemic. And we use that information in other areas of work. So I won't talk a lot about what Shatterproof does, but just to mention that in addition to Atlas, we do work related to stigma reduction. We have a public policy team that does both state and federal legislative work. We're happy to share any information about those other facets of work if you have questions. So now we'll go ahead and play just a quick, I believe we'll just do 5 minutes of this walkthrough of the facility survey. Amelia, I will turn it over to you for that. Oh, and I should have introduced Amelia earlier while she's pulling that up. Amelia Wilburn is our program coordinator. I know many of you have probably talked with her. She's always available to answer questions and help navigate through things. So thank you, Amelia, for all you do.
Thank you, Leah. For listening to this recording today, we wanted to take some time and walk you through the 2021 October Atlas survey that we're asking that providers in the Atlas states complete. We wanted to give you a high-level overview,
there's a
talk through some of the resources included in here, and get your minds to start to think about what information might be useful as you go through the survey and complete it. I'll quickly remind you all that we sent out a reference copy of the survey last week. So if you want to take a look at the survey questions on your own time, feel free to take a look at the reference copy, or if you haven't received it, feel free to reach out at atlas@shatterproof.org to take a look and to let us know so that we can send it to you. So this is the landing page for the October 2021 survey. This is what you'll see when you ultimately receive an email to the primary contact at your facility with your facility specific link. When people go to complete the survey, each facility has its own specific link. So when taking the survey, you want to be very careful to make sure that you're using a link that is specific to a facility, and by facility we mean single site of care, has its own unique physical address. Once you click the link, again, you'll be taken to this landing page. You'll have very high-level instructions here. Feel free to read through in your own time. And what you'll also notice is there's some helpful links at the top of the page. So if you want to look at the reference copy of the survey as you're taking it, you can select this 2021 survey link up at the top. If you want to peruse the FAQ while you're taking the survey, you can click the FAQ link at the top. And of course, if you're completing the survey and you think, I really have a question that I need answered before I can continue onward through the survey, you can click that Atlas Help Desk link at the top as well. And these appear on all of the survey pages so that you can use them as needed as you're going through and completing the survey. I'm going to go to the next page because there's a lot of helpful information. As you all probably know, the survey is going to be released on October 28th, 2021. So very close. And what we want to note with that is you'll receive an email from Atlas with your unique survey link. It'll be one link if you're overseeing one facility. It will be multiple links if you oversee multiple sites. So again, it's an individual link for each site of care. And so you will receive reminder emails throughout the data collection process every so often with these links, just in case you need a reminder, in case you're in the process of completing, in case you need that link again. And the survey ends on January 28th, 2022 at 11:59 p.m. Central Time, if you want to be very specific. As you're completing the survey, you use those buttons that you saw at the bottom of the screen. You navigate through those back and next buttons. You can always go back, you can always go forward. So if you want to go and revisit a question you previously answered, totally fine, feel free to do that. If you want to continue to move forward through the survey, you'll hit next. What you may also notice is that as you're clicking the next button, as you're going back, your response is saved. So you can always leave the survey and return to the survey, and any progress that you have made will be saved within that online survey link. You have to use your facility specific link for your responses to be saved, so don't use any other links, but as long as you're using that facility specific link that Shatterproof saved to you, your responses will be saved. You can return to the survey at any point. What we want to also note to our previous states is that some of your responses may be pre-populated. This is specific to providers who have completed the survey before. If you're a new Atlas state, this doesn't apply to you at all. If you have previously completed the survey in 2020 for Atlas, you will have some of your questions already answered. And this is because we've pulled in your data from 2020. So what we encourage you to do as you're looking through these is, take a look at your questions, look at the responses that have been pre-populated, and make sure that those responses are still accurate. We've added some new response options to some questions, so you'll want to go through, read those questions, look at the new response options, and make sure your selections are accurate. What I also want to point out is we cannot pre-populate the other fields. So if you want to add other response options to pre-populated questions, you'll want to select that other response option and then add any other items that apply to you, whether it's other assessments, other types of services, to that text field so that we have that captured and we have it accurately reflected in your data. I'll quickly note that some questions are required, some aren't. You'll be able to see them with that little red asterisk you see right here. And as mentioned, we have a couple of helpful resources for you. One is linked here. You can always go look at treatmentatlas.org. You can search for your facility. You can look at your profile. Always good to have that linked there. We include here and always at the top of the page link to the reference copy of the survey, just in case you want to look at that paper copy, in case you want to print it out, circle some of the responses so that you can go through and add those to the online survey once you get your link. Totally fine. What I will say is we can't accept paper copies of the survey. We have to accept online versions. But if you do want to ahead of time answer the questions, it's perfectly okay to print the survey, make your selections on paper, and then transfer them into your online survey. We also have a frequently asked questions section, as mentioned. You can click here, you can check it out. We have the help desk. And then another thing I want to quickly mention to you all is we have office hours. So if you want to get some time one-on-one with the Shatterproof staff person to answer your survey questions, you can sign up for office hours. The link is there. What we ask is you provide a little detail on the help that you need specific to the survey, and then we'll reach out to schedule some time to connect. So all of these options are available to you as you're completing the survey, and we want you to take full advantage of them so that we can support you in your submission process.
And I'm going to skip ahead just a moment as,
These
sorry.
are fine for you as you're
Skip ahead just a moment as Shannon is explaining the details of how to take the survey. So all that information is included in the survey itself, but it's also in this video if you want to reference. But for now, let's resume.
So we start with section A, which is your contact information. These are very straightforward questions. They're asking you to confirm your address. If it's not updated appropriately, if you need to make a change to your address, all you need to do is select no. And we'll have some fields for you that will allow you to update your address so that it's the most current address on file. We ask a few questions to confirm that your facility falls within the sampling frame. Do you offer substance use disorder treatment? Are you an addiction treatment facility? Are you currently open? Do you offer in-person treatment, since we're collecting surveys primarily from and only from in-person facilities at this time, facilities that are offering in-person care. And we also just want to make sure that that your facility doesn't only offer care to certain patients, particularly those individuals who are currently incarcerated. We ask for some contact information. I'm just going to input some test numbers, but you'll see above these different items, you have examples. So it gives you the format in which you want to submit certain items or information. So I will follow that format, type in that information, and include it there. An email, you just want to make sure anytime you ask for an email that you include it, that the email is in the correct format. It has that at google.com or any kind of thing that at gmail.com, at gmail.com, so that it's in an appropriate email format and that we can catalog that. I will note that this information is not publicly shared. We don't share any contact information with external parties that's submitted through the Atlas Treatment Facility Survey, so no contact information that you provide here will be shared. So no worries about that. We want you to feel secure in sending that to us. Another field, just to get contact information, we ask for both the CEO as well as the person taking the survey. So I'm going to complete it by using the same formats. A new question that we're asking is, and we would love to get your responses for, is how best can patients contact your facility? We have a number of options here. If none of these apply, you can always select the other option, and we'll allow you to import or add the other way that people can contact your facility. You'll see if you make selections here for email or phone, these options appear below for you to add, and you'll add the specific phone number or email that patients should use to contact your facility. We'll add a phone number for now, but this is information that we'll use on our site to allow patients to directly connect with your facility. So we're using a process that is most amenable for your site. You can add your organization's website. We'll add Shatterproof. And actually we'll, and then, is your organization owned or operated by a separate larger entity or parent organization? This is if you're in a situation where there are multiple sites across your state or otherwise that all are underneath the header of a larger organization. So if that's the case, you want to say yes. If you're an individual facility, you don't have that larger organization, you'll want to select no.
And so we'll pause it there as you get the idea. Leah, I'll turn it to you.
Yeah, actually, this is probably a great time to, I know we have Q&A at the end, but given we just started to walk through that survey, does anyone have questions right now? You can go ahead and take some questions if you have them. And while you're, feel free to put those in the chat, or you can unmute yourself. While you're doing that, I just want to remind you that we will make the full walkthrough. If you want to finish going through this walkthrough, which I thought was really helpful, we'll make that available in the email we send after this presentation, so you all can take a look at that. But would love to take any questions. Amelia, do we?
You know, in the beginning, you all said something about October 28th, and I wasn't really clear on what's happening on October 28th.
Yes, I think, is that Janice? Yeah, great question, Janice. So October 28th, thank you for moving the slide.
Okay.
It's the date that it opens, yep.
Okay.
So you'll get an email with a link to the survey, and then on October 28th is the first day you can go ahead and fill it out.
Okay.
All right. So there's another question in the chat. From Kristen, our perinatal treatment programs, mother-baby programs, specifically searchable on the Atlas site for the Pennsylvania area? That's a great question. So right now, I don't believe we don't collect that level of information, but it's always interesting to hear questions like that, because we do make additions to the survey each year based on provider feedback. So we'd love to hear if others think that that would be something worth collecting in the future. It will not be on the survey this year. Question from Diane, how long does the survey take to complete per site? And you think, thank you, Amelia, so 30 minutes to 2.5 hours. We found that average is about 1.5 hours for most facilities if you're doing it for the first time in particular. As Carolyn mentioned, and Shannon mentioned in the walkthrough, if you did the survey in previous years, so talking to my Louisiana folks who are on the phone, potentially if there's North Carolina folks on the phone as well, if you did the survey last year, some of your information will be pre-populated, so it's a little quicker to get through. And for all of those from the states that are just implementing Atlas for the first time this year, I would plan for that 1.5 hours. We did send out on I believe the 15th, a copy of the treatment facility survey Now that's just, thank you. There we go. There's a slide. So that's just a reference copy. You're not going to fill out anything on paper ever. It is electronic, as you saw in Shannon's little walkthrough. But if you take a look at that reference copy of the survey and kind of get familiar with the information we're asking for, obviously you can do that in the walkthrough as well. Typically, you're going to need more than one person at a facility in order to complete the survey. And using that as almost a worksheet to prepare yourself for the actual survey will reduce the amount of time it takes once you actually get to it. Let's see, question. Will ability to treat adolescents under 18 be included? Yes, we do have information on adolescent specific programs in Atlas, and that will be a question that you can answer. If we have multiple sites throughout one state, how should we approach filling out the survey?
Yeah.
Oh, Carolyn.
No, I'm sorry to interrupt. I was going to say I can dive in. That's actually the next slides if it's helpful.
Oh, perfect. Yep. Let's turn it over to you. Go ahead.
That is great timing. So I'm so glad. I'm trying to see who asked that question. Anthony, I'm so glad that you asked that question. So for the survey, we have an alternative option for large organizations. And so what we mean in this case is that's any organization with at least 2 locations. So, for instance, if you're care and treatment centers and you have 2 sites, that meets the requirement. And when we talk about this option, it really applies to those facilities where there's a lot of similarity between the processes and protocols at each facility. And yes, we'll talk a little bit more. I love these questions. Please keep them coming. We will get to them in the Q&A. And then with this alternative option that I'm about to describe, you have to let us know if you want to partake in this option by January 14th, 2022. So 2 weeks before the end of the survey. So you have a lot of time to decide. And so how this alternative option works. And as I dive in here, I'll note that for those of you in a parent organization with at least 3 facilities, virtually all of you should have received an email this morning with information about this option. We're in the process of sending out the last of those. So those with just 2 sites will be receiving them probably this afternoon or tomorrow, but it walks through all of these components. And so you'll get the chance for me describing it now, and then you'll also see it in that email. And thank you, Amelia, for adding the full walkthrough, and we'll include that when we send it out. So when we describe this alternative option, what we mean is that you will complete 1 survey. So that's what Shannon showed in the walkthrough. And then we will then copy the data from that survey to each of your facility surveys. And then from there, you will only have just 15% of questions left at each individual survey. And you may be wondering, why are there any questions left if I'm copying the data? There are certain questions that are site specific and that we ask that you respond to at the physical site level. So for instance, accessibility. Even if you know in your head that all your sites are accessible, we want to make sure that you take the time to answer that question by facility. And when you receive an email from us, you'll get a table, something like this. And so we ask that you put the name of the facility where you want the data copied from in the first column, and then the facility or facilities where you would like it copied to in the second column. And so there's no limit on the number of facilities we can copy it to. As we were sending this today, we know that there are some parent organizations with more than 40 sites. If you want to fill out 1 survey and have all that data copied to the other 39 sites, that is certainly possible. And I'll note that importantly, you must still attest and submit each facility survey. So you still need to have your CEO or senior leadership attest to the accuracy of the information in the survey and then submit that survey. So just to reiterate that process, you'll complete 1 survey, or for instance, if you have a bunch of residential sites and a bunch of outpatient sites, you could complete 2 surveys and then have those data copied to other facilities. And then you only have 15% or less of questions left to submit in a single survey. What about 1 site in multiple states? We can do the same if you have a facility that spans multiple states. So you have sites in Pennsylvania and in Louisiana and North Carolina, we can do the exact same and copy across the states. And so some benefits of this option: it helps streamline the survey submission process and can certainly save time and administrative burden if your sites are fairly similar. If your sites are very distinct, and so the services at one site are nothing like the services at the other site, it probably doesn't make sense to do this option. But if they are fairly similar, then it likely does. I'll also note that if you submitted data for all of your sites or virtually all of your sites last year, and you have those pre-populated surveys, it's likely that it will be easier for you to just go in and change any pre-populated information rather than doing the full survey again. So for those of our attendees in Louisiana and North Carolina, if you filled out all of your surveys last year, it's likely easier for you to go in and change anything individual in each survey rather than filling out one survey, having the data copied. And again, we sent out an email about this morning. We're sending the remainder of those emails either later today or tomorrow. So if your site if you have more than if you have 2 or more facilities in your parent organization and you didn't get an email from us, please contact us at Atlas@Shatterproof. We want to make sure that we have all of your sites included in our system, and also that you can take advantage of this option if you want. And then just in terms of some key tips, and Leah and Shannon both touched on a few of these, we often find it's helpful to assign a single staff member as really that Atlas champion, kind of the go-to person for anything Atlas related. And it's usually helpful if this is somebody who understands the offerings at your facility or facilities, so potentially a program director or clinical director. What info? Oh, thanks, Ford. Oh, I'm so glad. That is a great question, Ford. We will answer that during the Q&A section. So as we noted, we have a reference copy of the facility survey that was sent out. As Leah noted, it may be very helpful for you to fill out that reference copy. So then when it's time to enter the information, instead of having to go page by page and then think about the question, you can have all that information in the reference copy and then click through really quickly. As Leah noted, we don't accept submissions via PDF or paper. So you can't submit your survey as a reference copy, but we found that it's very helpful, especially for facilities with a lot of different sites. And as Leah mentioned, we really recommend that you plan out time on your calendar. That 1.5 hours usually is about how much we estimate. And if you want, you could break it up over the 3 months. You could do 30 minutes a month. Also, similarly, putting time on the appropriate staff's calendar. So as we mentioned, there is an attestation at the end from a CEO or similar senior leadership. It can be very helpful to schedule, say, a half hour, 45 minutes, an hour on that person's calendar so that you can then send them every single survey to attest and they can breeze through those. And we ask that you review data before submitting. So if you have any questions after you've submitted, if you have any changes after you've submitted a survey, you can't automatically go in and edit it. You'll need to contact us at Atlas@Shatterproof. So we really recommend that you go in there, make sure that all of your data are accurate. Thank you very much. Are accurate before submitting. And before we go into benefits of the TFS, I just wanted to see, are there any questions about that portion of the presentation, about the parent organization survey or some of the key tips for completing the survey? And while people are thinking, I know that we have a few questions in the chat. Nicole asks, what's the difference between a SUD treatment facility and an addiction treatment facility? In this case, apologies for the confusion, these are interchangeable. And so we think of an addiction treatment facility as a specialized site that provides addiction treatment and is really designated to mainly provide addiction treatment. In several of our states, we also include community health centers, or federally qualified health centers, and potentially office-based providers. But if you have been contacted by our team, then you are in scope for the Atlas survey. And in terms of the types of treatment, and so you will see in the survey, so we are looking for all facilities that offer addiction treatment. And great, I'll get to that question as well. All facilities that offer addiction treatment. We are not including facilities that do not offer treatment. So at this time, we're not including sober living facilities, recovery homes, or preventive or harm reduction programs that do not offer treatment. In the survey, you'll note that we ask about different components of treatment. So we ask about the behavioral therapies you use, how you assess clients at intake, what medications you offer for addiction treatment, what coordinated care you have on site, what recovery support services you offer. And so it's basically, as Leah said, it's filling out kind of a menu of your offerings. And I'll take just the last two questions and I will turn it over to Angit. Great question. So Ford asks what info may be updated between TFS collection and what data can only be entered in the full TFS. Great question. So Ford is basically saying, if we submit this survey and then there are some changes, when can we change that information basically, and what information can be changed when? That's a great question. So any updates to your service offerings, so whether or not you offer medication, what level of care you offer, what evidence-based behavioral therapies you use, those can only be updated in the treatment facility survey. So the survey is open twice a year. This is obviously our first time for several of our new states. And so you'll have that opportunity to update twice a year, and you'll need to wait for each of those survey periods in order to make those updates. If you have a smaller change to your facility to address, name, phone number, insurance accepted, those updates can be made at any point. And so once you've submitted your data, you will get access to a portal, and you can request updates to your facility through that portal. And then for now, I will turn it over to Angit, and I will save Anthony and Kristen your questions for our Q&A section.
Excellent. Thank you, Carolyn, and good afternoon, everyone. So here we'll talk about the many benefits of participating in the TFS. I'll quickly go through 6 here. So first, the benefit is ensuring that your treatment facility is accurately listed on Atlas. I'll combine the second and third ones in terms of demonstrating transparency and quality. The fourth item here is leveraging your password protected portals to find areas of improvement. And this is based on actual data versus something like perception. Number 5, increasing your data or your facility's visibility in a searchable database. And number 6, most facilities have unique qualities, and Atlas will allow this to be shown to the public. So some additional reasons to participate in Atlas include having your own password protected portals. On these portals, you'll be able to access data on how your facility compares to state averages, and you can also identify areas for improving quality. And speaking of improving quality, we also have our continuous quality improvement learning series. This is where we have subject matter experts, provider panels, provide their experience as it relates to improving the quality of care in treating substance use disorder. If you have any more questions on that, you can visit the site, which is treatmentatlas.org/CQI. And lastly here, we also will work very closely in the states to help promote Atlas. In our current states, we have integrated with state resources such as helplines. We provide a collateral, so whether it's business cards or postcards to referral sites. We've also advertised on buses and billboards. So we're all about working together to help spread the word. So our Atlas team is here to help in any way that you may need it. So first, we have our Atlas survey FAQs that you can access by clicking on the embedded link on the slide. Secondly, you can submit a ticket to our Atlas help desk and you'll receive a response within 48 hours. As you're submitting the ticket, it's always helpful to be as descriptive as possible. Third, you can also use the embedded link to access a form where you can schedule time during our Atlas office hours. This will allow you to schedule 30 minutes with us one-on-one, where we'll help you answer questions that you may have on your surveys. And I think Shannon mentioned this earlier. Again, as much detail as you can provide, it'll help us make sure that we have the answers ready for you. And you can always email us at atlas@shatterproof.org. The inbox is monitored by our team, and we always endeavor to respond within 48 hours. On our last slide, you can always reach out to your state director as well, and we'll have that information there for you on the last slide. So other ways you can sort of stay updated and receive updates on Atlas, but also ask questions are these provider roundtables. You'll see the dates and registration links to the remaining 3 sessions over November, December, and January. So please register and add them to your calendar. And I think, are we going to ask a polling question here? Oh, all right, your questions, perfect. So at this point, I think I'll turn it over to Amelia to moderate our Q&A session. Amelia.
Hi, everyone. Thank you so much for being so active in the chat. So we have some really wonderful questions, and I'll start with a question from Anthony. And Anthony asks, how do we register a new site or location? Say we open a new facility between now and January. How can I register this? So that is an excellent question. I'll open it up to Carolyn to answer that.
Great question, Anthony. Thank you for your questions throughout. Email us at atlas@shatterproof.org. And so just for some context, in most of our states, the list of facilities is determined by licensing or certification from our state partners. And so there may be a little bit of time after you email us where we contact the state partner just to confirm, and then we get back to you. But yes, I would say email us at atlas@shatterproof, and we will take care of that. I know Amelia and I received an email yesterday. So.
Yeah, awesome. So thank you, Anthony. I'll move to the next question. This is from Kristen. Is there a question specifically about whether there are certified recovery specialists available?
Great question. We do ask about peer recovery specialists. So we ask about the different licensed or the different trained and staff and educated staff at your facility, as well as peers available at your facility. And then we display whether or not they're present in the Atlas profile. I don't know if I said that very coherently. We do ask if there are recovery support specialists available at a facility.
Awesome. Okay, a question from Rachel. Do you expect that providers will use Atlas for referral from a facility that does not offer treatment to one that does?
Anga, do you want to talk a bit about this and about the latest QI session that you just worked on? Because I feel like that's pretty relevant here.
Sure. So yeah, in terms of the CQI session that hopefully everyone's able to attend, it's working in making sure that there's a streamlined process as it relates to identifying those that might have SUD treatment in the emergency room department, and sort of just some data and kind of a case study that talks a bit about that. And so there is opportunity. In our speakers, California Bridge, will talk a bit about this. What are some tactics that can be used to help refer patients to in the emergency room setting specifically to treatment versus if those signs are missed. For example, someone's going through withdrawal. Obviously, the process will be delayed significantly. So I look forward to having folks attend that CQI session that sort of touches on this. Thanks, Carolyn.
Sure. And I'll note that that's a great question. We do a lot of our work with referral sources that do not offer treatment themselves. So for instance, with potentially primary care facilities, Leah's worked extensively with the justice system in Louisiana, met with drug courts before. And so several entities that may encounter people with addiction or with substance use disorder needs who don't offer treatment themselves and are looking for treatment. Or similarly, for providers who offer treatment, but may be looking for a different level of care for a patient. So that really is one of our focuses is on those that don't offer treatment themselves, but need to look for it regularly.
Awesome. So we just had a question from Rachel, and this also pertains to CQI. So would providers be able to see the CQI data if they are not from a treatment facility, but are looking for a set of facilities to refer to?
Great question. So very similarly, anybody can use the Atlas website. It is completely free of charge and completely open. So anyone and anywhere throughout the United States can go in and search for a facility, or even beyond the United States. That data, those data are all publicly available. So those are the Atlas profiles. That more detailed data that Angad talked about, these portals, are only available to those providers who submit the treatment facility survey. If you don't submit the survey, you don't have access to this portal data. The CQI series, however, is open for all to attend. So Angad talked about an upcoming event we have, for example, that's open to all of our stakeholders.
Awesome. So this is a specific question about the TFS. This is from Nicole. And they ask, in section F of the TFS, what are acceptable forms of education or training for therapeutic modalities, as in continuing education classes? Also, do you consider MI equivalent to MET?
That is a great question that I don't know off the top of my head. I know that you're talking about this section that's all about behavioral therapies. Amelia, I'm sure that you've already had it written down, so we can answer that afterwards.
Absolutely. And anyone else, also, if we don't get to your question right now, we have captured all of your amazing questions and we will get back to you. But I'll go in the order that they were received for now. Jessica asks, if some of our sites are pending with licensing, should we submit them to be added?
I would say that I would wait until they are fully licensed to then submit them. And so you have up until January 28th to fill out the survey. And so we'll be accepting, if you say on January 26th, I have a new facility, we will add it into our system ASAP so that you can fill out the survey. But currently we're not including facilities who are pending licensure.
And Rosemary asks, can we get data for benchmarking by populations, as in by age, payer, or something else?
Leah, Angad, feel free I'm happy to answer, but I also don't want to take up too much space. So if you have any thoughts, feel free to jump in. Otherwise I can dive in.
Sure. I don't know specifically the answer to that question, but I know that we've added a lot of functionality to our password protected portals. I think you can probably stratify the data by some of that, but not all of it. And we do have more information available on the password protected portals, and possibly, Carolyn, a walkthrough of them. We don't have publicly available now, I don't think, but we should soon. So that we can put that in the follow-up after this webinar.
Awesome. Will the provider, this question is from Amy, will the provider organization be able to include facilities in states that Shatterproof is not partnered with on the survey?
Yeah, I can help answer that one. So, as of right now, we're only working, with states that we've sort of officially partnered with. So, to answer the question, if there are facilities in states that, we don't have a presence or sort of a working agreement with the state yet, we're not going to be able to include them as of right now.
Thank you, Angad. Carolyn, would you like me to keep going down the list? Okay, you got it. This question is, what is the engagement rate for your site and how many referrals have been made from this contact?
Great question. And so I think this is referring to kind of, how many people are using the website. So I'll say that we've had over 150,000 people visit the website since it went live in July of last year. And we continue to see that number grow. As Angad noted, we're very devoted to promotion. I'd say that we've seen in the range of 15,000 facility views, so people going and looking at an actual facility. And currently on the Atlas website, we have about 2,600 facilities total. So obviously there's some repeat views in there. We don't yet have a number on specifically people who go to treatment after visiting Atlas, but we are in the process of adding a feature to the website so that if a patient is interested in getting treated at a specific facility, they'll be able to click a button and have their information sent to that facility. So then the facility will be able to directly see how many people are getting interested in their site from Atlas.
Awesome, thank you, Carolyn. We just have 2 more questions. We'll just go through them really quick. The next one is, you shared on the benefits, this is from Betsy. You shared on the benefits of joining Atlas. Will there be programs that do not participate?
Great question. Yes, Angad, do you want to jump in?
Oh, sure. No, I was going to say, yeah, so there will be programs and facilities that do not participate. Each state, I think, tries to encourage the providers and facilities to obviously send in the survey for all the benefits that we mentioned. But to answer the question, Michael, there will be programs that do not participate. Hopefully it's few and far between, but hopefully we can encourage everyone in all the states to participate.
Awesome. And the last question also is from Betsy. Feel free, everyone, to post more questions in the chat. We will definitely get back to you on them. And this is, are you encouraging non-treatment programs to bypass referrals to the SCA for assessment and referral?
Yeah, so I think this is for Pennsylvania. Betsy, good question. So, the current processes that exist in Pennsylvania as it relates to the SCA will remain unchanged. And so whatever the normal process is for, the non-treatment programs to work with the SCAs in terms of, referral and assessment, that'll continue as Atlas rolls out in Pennsylvania.
Awesome. Well, that was all the questions that we have so far.
So Angad mentioned this earlier. We have another poll. So we asked you at the beginning about your thoughts on the survey. How do you feel now about completing the survey? And please be honest, as Angad said, we are truly here to help. And so if you feel not confident at all, we will happily schedule time to talk with you. I'll give about 10 more seconds. See that the responses are slowing down. So Amelia, if you want to end the poll and show the results. So you can see here, most people are feeling, virtually all people, over 90% are feeling somewhat confident or very confident. And there's a remaining 8% of those who responded who feel otherwise potentially unconfident or something else. We certainly invite you to email us. That is why we're here. As I said, there are real people answering the emails. So Angad, do you want to take us out then?
Sure. Thanks, Carolyn. So next steps. So please complete the treatment facility survey that you'll be receiving between October 28th and January 30th. And feel free to complete it as soon as you receive it. We will certainly welcome that. You'll save yourself plenty of emails and outreach from us. And then again, if you have questions, please do not hesitate to reach out. And any of the ways that we mentioned earlier, we are absolutely happy to answer questions, and we are always available. Also, please register for the upcoming roundtables. If you haven't already, get them on your calendar. As you saw here today, lots of good questions are being asked. And so I think there's a learning opportunity, obviously, in the content that we present, but also in the answers to a lot of the great questions we received as well. And as I mentioned earlier, this is a slide with our contact information here. So I covered Delaware, Massachusetts, Pennsylvania, and West Virginia. You can see the states that Carolyn works in, and also Leah as well. And again, as Carolyn mentioned earlier, no matter what state you're in, you can check out treatmentatlas.org. understand how the platform works. If you have questions, again, please don't hesitate to let us know. And as we mentioned, we have the help desk, the office hours, the Atlas at Shatterproof email address. Obviously, our email address is here as well. So just want to take another quick minute here to thank you all for taking the time to participate today, to ask really, really good questions. And we're looking forward to our next roundtable and to continue our process towards getting the survey completed. So thank you, everyone.
And I just wanted to add that if you're in Oklahoma, we'll be having some in-person meet and greets to talk about Atlas and answer questions. So if you didn't receive an invite to that, please feel free to reach out to me. My email's here on the slide, but I'll put it in the chat as well. And same with Florida, we'll be looking at some in-person meetings in November.
That is such a great point, Leah. If you're in North Carolina and you'll be attending the Addiction Providers of North Carolina conference that's coming up this coming Monday through Wednesday, I will be there with a booth. So you're welcome to come and visit me in person. And I'll also be at the Pinehurst conference in December as well in Pinehurst. And
I'll add a quick commercial as well for those in Pennsylvania. I'll look forward to virtually attending the psychostimulant meeting, I believe on, I think it's early December, December 1st, 2nd. So looking forward to that as well.
Thank you all for your time. Let us know if you have any other questions, but great talking with you today, and we look forward to working with you in the coming months.
Thank you all. And Rachel, a good question about the CQI. I just added the link to the chat, which is our CQI page, which includes all of the information as well as registrations, I believe, though Amelia, feel free to correct me if I'm wrong about the registrations there. And so I'll note that we haven't yet sent out CQI to most of the providers on this call, just because we don't want to distract you from the survey. But as soon as you finish the survey, you will certainly receive more information about CQI. So thank you so much. Glad it was helpful. Feel free to stick around and chat with us. Otherwise, enjoy the rest of your Wednesday.
Take care, everyone. Bye now.
So if I can ask a question from New Jersey, Caroline, I think you're our person. I don't know a whole lot about what we're doing. This was my first real participation. So I have to find out more. I have to identify an Atlas champion and get our QA person involved. So what's the rollout seem like to you for New Jersey getting on board?
Great question. So I've been presenting in New Jersey over the past several months, just on the NJ quarterly provider meeting, also the NJ PAC, and a few of the PICADAs as well. I'll be presenting at Gloucester County this next Thursday, not this Thursday. And I think presented in Mercer County, though don't quote me on that. So I'll be presenting over the coming months at many different PICADA events, as well as with the state will be sending out emails, which you may have received already, as well as Horizon, who's our funding partner in New Jersey, will be sending out emails as well to their network. And so New Jersey will be on the same timeline as the other states that we mentioned today.
Okay. All right. I will look for those. We're in northern New Jersey, so we're in Morris and Passaic counties.
Oh, I have lots of friends who live there and would be happy to come out and meet in person if you want to have a coffee chat and have any questions.
Okay. All right, great. Thank you.
Sure.
I'm going to take off now.
Okay, I got a question. Carolyn?
Go for it.
Okay, yeah. I had to attend a funeral when our staff member passed away. A funeral was today. So by the time I got back, like the last 20 minutes, when might it be offered again?
Great question. So we will have a roundtable in November. Let me just pull that up to make sure I have it clear. On November 15th, And we'll also be sharing the recording from this event probably in the next 2 days or so. And Amelia very thoughtfully shared all of the registration links in the chat. So if you scroll through and see all of those Zoom links, you can click those and register right now to get them on your calendar.
Okay, all right. I did send Amelia an email already, but I register right now. And also, do I have to attend one of these before we do a one-on-one 30-minute session?
Nope, you don't. Nope, you can register for one-on-one whenever you want. So please feel free to dive in and register for one of those.
Okay, great. Thanks.
You're welcome.
Roscoe.
Any other questions? Our team is getting better with silence, but I know that I still get a little anxious. Okay, in that case, we will end just 3 minutes early. You back a petite 3 minutes of your day. Thank you all for attending. We're very grateful that you took the time to join us today. And we certainly look forward to helping you complete the survey and seeing your submitted survey. So have a lovely rest of your Wednesday.